everyone, we are the group B3 and we were going to discuss diabetes mellitus.
I'm Zia Lorraine Prado.
My name is Zarana Paranpan.
I am Maria Antonia Fevina Vaz from BSN1 King.
I'm Lancy Marie M. Atadoy from BSN1 King.
I'm Jeffrey Palmos from BSN1 King.
Diabetes mellitus, often known simply as diabetes, is a chronic metabolic disorder characterized by high blood sugar levels or hyperglycemia due to either the body's inability to produce enough insulin or to use insulin effectively. Insulin is a hormone that helps regulate blood sugar by allowing glucose to enter cells for energy. Without proper insulin function, glucose accumulates in the blood, leading to various health complications. Diabetes mellitus is taken from the Greek word diabetes, meaning siphon, to pass through, and the Latin word mellitus, meaning sweet.
Structures and functions affected by the diabetes mellitus. Pancreas. The pancreas plays a central role in diabetes. In type 1 diabetes, the body's immune system attacks insulin-producing cells in the pancreas, leading to little or no insulin production. In type 2 diabetes, the pancreas produces insulin, but the body becomes resistant to it, causing the pancreas to overwork and eventually produce insulin. Liver. The liver stores and releases glucose in response to insulin signals. However, in diabetes, the liver may release more glucose than necessary because insulin signaling is disrupted. This adds the high blood sugar levels, especially in type 2 diabetes. Heart and blood vessels. High blood glucose damages the lining of blood vessels, increasing the risk of cardiovascular diseases. Diabetic patients are prone to hypertension, atherosclerosis, the hardening of the arteries, heart attacks, and strokes. This happens due to increased cholesterol levels and the strains high sugar places on the circulatory system. Kidneys. Diabetes can damage the small blood vessels in the kidneys, leading to diabetic nephropathy. Over time, the kidneys lose their ability to filter waste from the blood effectively. If not managed, this can result in chronic kidney disease or kidney failure, requiring dialysis or a kidney transplant. Eyes. High blood sugar can damage the blood vessels in the retina, leading to diabetic retinopathy. This condition can cause blurred vision and, if untreated, may lead to blindness. People with diabetes are also at a higher risk of cataracts and glaucoma. Nerves. Diabetic neuropathy refers to nerve damage caused by prolonged high blood sugar levels. It most commonly affects the feet and the hands, causing numbness, tingling, or pain. It can also affect digestion, the heart, and sexual function. Skin. Diabetes affects blood circulation and can lead to poor wound healing and making the skin more susceptible to infections. Diabetic patients often suffer from bacterial and fungal infections, as well as skin conditions like diabetic dermopathy. Brain. Diabetes increases the risk of cognitive decline and Alzheimer's disease. Often referred to as type 3 diabetes, chronic high blood sugar can damage blood vessels in the brain, leading to memory problems and reduced cognitive functions. Lastly, digestive system. Diabetes can impact digestion through diabetic gastroparesis, where the stomach muscles fail to work properly, delaying the emptying of food. This causes bloating, nausea, and erratic blood sugar level.
Etiology and risk factors. Etiology: too much glucose circulating in your bloodstream causes diabetes, regardless of the type. However, the reason why your blood glucose levels are high differs depending on the type of diabetes. Causes of diabetes include insulin resistance. Type 2 diabetes mainly results from insulin resistance. Insulin resistance happens when cells in your muscles, fat, and liver don't respond as they should to insulin. Several factors and conditions contribute to varying degrees of insulin resistance, including obesity, lack of physical activity, diet, hormonal imbalances, genetic, and certain medications. Autoimmune disease, type 1 diabetes, and LADA happen when your immune system attacks the insulin-producing cells in your pancreas. Hormonal imbalances. During pregnancy, the placenta releases hormones that cause insulin resistance. You may develop gestational diabetes if your pancreas can produce enough insulin to overcome the insulin resistance. Other hormone-related conditions, acromegaly, and Cushing syndrome can also cause type 2 diabetes. Pancreatic damage. Physical damage to your pancreas from a condition, surgery, or injury can impact its ability to make insulin, resulting in type 2C diabetes. Genetic mutations. Certain genetic mutation can cause moody and neonatal diabetes. Long-term use for certain medications can also lead to type 2 diabetes, including HIV/AIDS medication and corticosteroids.
Risk factors. Family history. A parent or sibling with diabetes increase your risk due to generic factors. Obesity. Excess body fat, especially around the abdomen, leads to insulin resistance, increasing type 2 diabetes risk. Physical inactivity. A sedentary lifestyle raises diabetes risk by contributing to obesity and reducing insulin sensitivity. Unhealthy diet. Diets high in produced foods and sugar leads to weight gain and insulin resistance. Age. The risk of type 2 diabetes raised after age 45 due to decreased activity and insulin sensitivity. High blood pressure. Hypertension often coexists with diabetes and share common risk factors. High cholesterol. Elevated LDL and triglyceride increase diabetes and cardiovascular risk. Ethnicity. Certain ethnic groups like African Americans and Hispanics are at higher risk for type 2 diabetes. Gestational diabetes. Women with gestational diabetes or who give birth to large baby are the higher risk of later developing type 2 diabetes. PCOS, polycystic ovary syndrome, is linked to insulin resistant and type 2 diabetes. Smoking. Smoking raises the risk of insulin resistant and diabetes complication. Poor sleep. Lack of sleep disrupts insulin regulation and increases weight gain and diabetes risk. Stress. Chronic stress raises blood sugar and promotes behaviors that increase diabetes risk. Prediabetes. Individuals with prediabetes are at high risk of developing type 2 diabetes.
Types of diabetes. There's a lot of types of diabetes, but here are the most common ones. Type 1 diabetes. It is an autoimmune condition in which the immune system attacks and destroys the insulin-producing beta cells in the pancreas. As a result, the body produces little to no insulin, requiring individuals to manage their blood sugar levels with insulin therapy. Type 1 diabetes often develops in childhood or adolescence, but can occur at any age. Type 2 diabetes. It is a chronic condition where the body becomes resistant to insulin or the pancreas doesn't produce enough insulin. This leads to elevated blood sugar levels. Type 2 diabetes is often associated with obesity, inactivity, and poor diet, and typically develops in adulthood, though it is increasingly seen in younger people. Gestational diabetes. It is a form of diabetes that occurs during pregnancy when hormonal changes cause insulin resistance. It usually resolves after childbirth. But women who experience gestational diabetes have an increased risk of developing type 2 diabetes later in life. Maturity onset diabetes of the young, or MODY. It is a rare form of diabetes caused by a mutation in a single gene that affects insulin production. MODY typically develops before the age of 25 and is often misdiagnosed as type 1 or type 2 diabetes. It is inherited in an autosomal dominant pattern, meaning that it runs strongly in families.
As for the complication, there are two major types of complication, the acute complication or life-threatening and the long-term complication. For acute complication, there are three examples. The hyperosmolar hyperglycemic state or the HHS. It affects people with type 2 diabetes leading to extreme dehydration and confusion. It requires immediate treatment. Diabetic ketoacidosis or the DKA, common in type 1 diabetes, occur when the body uses fat for energy, causing blood acidity. Symptoms include labored breathing and vomiting requiring urgent care. Severe hypoglycemia, extreme low blood sugar, causing blurred vision, disorientation, and seizure, need emergency intervention. As for the long-term complication, there are several examples. The cardiovascular issues include heart disease, stroke, and atherosclerosis. Nerve damage includes causing numbness, tingling, or pain. Kidney damage may lead to kidney failure. Eye damage can cause blindness. Foot conditions leading to infections or amputation, sexual dysfunction, erectile dysfunction, or vaginal dryness due to nerve damage. As for the medication for pharmacology, there are three examples. The insulin therapy is essential for managing type 1 diabetes and sometimes used type 2 diabetes when other treatments are not effective. There are several types of insulin, the rapid-acting insulin, which work quickly after meals, the short-acting insulin, which manage mealtime blood sugar spikes, the intermediate-acting insulin, which lasts for about a half day, and a long-acting insulin, which provide a steady release over 24 hours. As for the oral medication for type 2 diabetes includes several options. The metformin reduces glucose production in the liver and improves insulin sensitivity. The sulfonylurea stimulates the pancreas to release more insulin. The DPP-4 inhibitors increase insulin production after meals and lower blood sugar without causing hypoglycemia. The SGL2 inhibitors reduce glucose excretion through urine. The thiazolidines enhance insulin sensitivity in muscle and fat tissues. Number 3, for pharmacologic is the injectable medication for diabetes. Aside from insulin, include GLP-1 receptors agonists, which mimic incretin hormones to increase insulin release, reduce glucagon levels, and slow gastric emptying. Another option is amylin analogs, which are used to alongside insulin to better control blood sugar, particularly in people with type 1 and type 2 diabetes. For non-pharmacologic intervention, first is the dietary management. A balanced diet is crucial for managing diabetes as it helps stabilize blood sugar levels, focusing on whole foods like vegetable, lean proteins, healthy fats, and whole grains, while avoiding refined sugars and processed foods can reduce blood sugar spikes and insulin resistance. Portion control and mindful eating further support healthy weight management and overall health. Next is the regular physical activity. Regular exercise is key to managing diabetes. Aerobic activities like walking or cycling improve cardiovascular health, boost insulin sensitivity, and aid in weight control, especially for those with type 2 diabetes. Strength training enhances muscle glucose uptake. Exercise also improves moods and reduces stresses. Aim for 150 minutes of aerobic exercise and strength training twice a week for best result.